Hello and Hare Krishna, all my viewers. I am Dr. Arjun from Panacea Ure Multi-Specialty Hospital, Bangalore, India. In this video, we will talk about herpes challenges in females. Let's start with how herpes gets transmitted in females. Herpes spreads through direct skin-to-skin contact, including vaginal, oral, or anal sex, and kissing. But how exactly does it get transmitted through skin contact? Many people with herpes may wonder how they contracted the infection despite using condoms during protected sex. Here's the explanation. During oral sex, the thin and soft layer of skin can tear, allowing blood to leak out, though these tiny cuts and the blood are invisible to the naked eye. As a result, infected individuals unknowingly transmit the virus to their partner. To simplify, consider this. When you brush your teeth or use a tongue cleaner, minor cuts occur inside your mouth. These same minor cuts can facilitate the transmission of herpes during oral sex. According to the FDA, latex condoms significantly reduce the risk of pregnancy and transmitting HIV, the virus that causes AIDS, when used properly. However, condoms do not completely eliminate the risk of spreading herpes or other infections. It's important to note that, based on my research, many women show no symptoms of herpes, but are still infected and unknowingly pass the virus to their partners. This is called being asymptomatic. Herpes can be transmitted even without visible sores. When there are tiny cuts on the skin of both individuals and these areas touch, the virus is passed from one person to another. All viewers watching this video should note that, according to my research, most women with herpes do not show symptoms, but they can still have the infection and unknowingly pass it to their partner. On the other hand, most male partners who become infected typically show symptoms within 2 to 20 days. Let me emphasize here, all men and women should be careful while coming closer to each other, even for kisses, smooching, or oral sex. Your partner might have an asymptomatic infection from your ex-partner unknowingly and pass to you. The window period for herpes symptoms can vary between individuals. Usually the first signs appear 2 to 20 days after exposure, a period known as the incubation period. However, in some cases, symptoms may not appear for weeks, months, or even years, or some individuals may remain asymptomatic and never experience any signs. Herpes can also spread through tiny invisible cuts on the skin. When these areas come into contact, the virus can be transmitted even if no visible sores are present. How is genital herpes related to cervical cancer? How is genital herpes related to cervical cancer? There is a connection between genital herpes in women and a higher risk of cervical cancer, but it's important to note that herpes is not a direct cause. It is simply one of several factors that can increase the risk. This link is based on several observations. Women with genital herpes are more likely to develop cervical cancer compared to those without it. In studies on animals, some develop cancer near the site of the herpes infection. Additionally, parts of the virus have been found in abnormal cells of women with cervical cancer. However, this connection does not mean herpes causes cervical cancer. Most women with genital herpes never develop it, though a higher percentage of women with herpes do compared to those who don't have the infection. Women with genital herpes should take preventive steps, such as having regular herpes tests, ideally every year or every 6 months. These tests help detect abnormal changes in cervical cells early, allowing for quick and effective treatment, often in the doctor's office, to prevent invasive cervical cancer. In conclusion, while there is a link between herpes and cervical cancer, it's more of a reason to take preventive action than to be overly concerned. In conclusion, while there is a link between herpes and cervical cancer, it's more of a reason to take preventive action than to be overly concerned. Can women with genital herpes have children? Yes, women with genital herpes can absolutely have healthy babies. The key is being aware of the infection and working closely with your doctor during pregnancy. The greatest risk of passing herpes to the baby occurs during childbirth. If a woman has active herpes sores near delivery, the doctor might recommend a cesarean section to reduce the risk of transmission. If no sores are present, a normal vaginal delivery is generally safe. With proper care and monitoring, women with genital herpes can safely have healthy babies. Can herpes be cured? The answer is a qualified no in allopathy or modern medicines. However, it will be cured by Ayurveda medicines. I have already explained the formula in another video. You can watch the video, link is given in the description. Now let me explain you the treatment in allopathy medicines. Herpes infections like herpes keratitis, affecting the eyes, and herpes encephalitis, affecting the brain, can be effectively treated with new medications if caught early. These drugs are specifically designed to stop the virus from progressing in the eyes and brain. However, for surface sores, such as those on the skin or genitals, no such cure exists yet, as the drugs used for eye and brain infections haven't worked for surface lesions. Although no current drugs can stop the virus in surface sores, doctors can prescribe various treatments to reduce the pain, burning, itching, and discomfort that often accompany herpes outbreaks. There are also medications that help support the body's natural healing process, as well as antibacterial creams and ointments to treat any secondary infections. Research into finding antiviral drugs that can effectively treat recurrent herpes is an active and important area of study. Many universities and pharmaceutical companies are working on this, and several promising antiviral medications are in different stages of development and testing. While none are commercially available yet, experts believe that the ability to control or possibly cure herpes is not too far off. Genital herpes symptoms in female. Genital herpes in women differs slightly from men due to anatomical and hormonal factors, affecting areas such as the vulva, vagina, cervix, and other genital regions. Often, internal sores go unnoticed until they cause discomfort or complications. Managing recurrent outbreaks, particularly around menstruation, is a significant challenge for women, as hormonal changes during the menstrual cycle can trigger these episodes. Symptoms include internal and external lesions that may cause itching, pain during urination, or discomfort during sex. Treatment options include antiviral medications for frequent outbreaks, topical treatments for external sores, and hormonal management to prevent menstrual-related recurrences. In some cases, recurrent pregenital herpes, linked to previous venereal infections, presents diagnostic challenges due to the resemblance of sores to other STIs and the potential for asymptomatic transmission. Recurrences may be triggered by stress, illness, or irritation, with each episode varying in severity. Specific cases of recurrent genital herpes. In addition to the general understanding of genital herpes, there are particular instances where the condition presents more uniquely or poses specific challenges. Recognizing these cases is important for developing personalized treatment plans and better managing the condition. Severe recurrences. Some patients experience unusually frequent and severe recurrences of genital herpes, often linked to underlying health conditions like a weakened immune system or environmental triggers. In these cases, the sores may be larger and more painful, taking longer to heal. Suppressive antiviral therapy becomes crucial in managing symptoms and preventing further outbreaks. Patients with severe recurrences often face greater physical and emotional distress, requiring additional support such as counseling and pain management strategies. Herpes complicated by secondary infections. Genital herpes can sometimes be complicated by secondary bacterial or fungal infections, which can intensify pain, delay healing, and increase the risk of scarring. Treating these infections involves antibiotics or antifungal medications, alongside antiviral therapy. Strict hygiene practices are also recommended to avoid further irritation of the affected area. Early treatment of herpes outbreaks is essential to prevent these complications and minimize the disease's impact. Some patients may present with atypical symptoms, making diagnosis more difficult. These symptoms might include lesions in unusual locations, extended outbreaks, or signs resembling other conditions like dermatitis or allergic reactions. Clinicians must consider herpes even in atypical cases, using laboratory tests like PCR or viral cultures to confirm the diagnosis and guide treatment. Atypical presentations can cause more emotional distress due to diagnostic uncertainty, making clear communication and reassurance from healthcare providers vital. Let's understand what happens with herpes in immunocompromised patients. Immunocompromised individuals, such as those with HIV/AIDS, cancer, or autoimmune diseases, often experience more frequent and severe herpes outbreaks, with complications like widespread sores, systemic infections, and longer healing times. Aggressive antiviral therapy is usually necessary for these patients to control the virus and prevent complications. In severe cases, hospitalization may be required to manage outbreaks or treat complications. Close monitoring and consistent care are critical to maintaining the patient's overall health. Let's understand now herpes in pregnant women. Genital herpes can pose significant risks during pregnancy, especially in the third trimester, when there is a higher risk of transmitting the virus to the baby during childbirth, leading to neonatal herpes. To reduce these risks, healthcare providers may prescribe antiviral therapy in the final weeks of pregnancy or recommend a cesarean section if active sores are present during delivery. Regular prenatal care and clear communication between the patient and her doctor are essential for managing herpes during pregnancy. Women with a history of herpes should inform their doctor early on to develop a safe treatment plan. What happens in herpes and fertility? One area of concern for many women diagnosed with genital herpes is how the virus may impact their fertility or pregnancy outcomes, while herpes itself does not cause infertility. 1. Herpes in pregnancy. For women who are pregnant or planning to become pregnant, managing herpes is particularly important. The primary concern during pregnancy is the risk of neonatal herpes, a serious condition that can occur if the baby is exposed to the virus during delivery. Neonatal herpes, this rare but potentially life-threatening condition occurs when a newborn contracts herpes during birth. If the mother experiences a herpes outbreak at the time of delivery, the virus can be passed to the baby through contact with the birth canal. Neonatal herpes can cause skin, eye, or brain infections in the newborn. Reducing risk during pregnancy. Pregnant women with a history of genital herpes are typically advised to take antiviral medication during the final weeks of pregnancy to reduce the risk of an outbreak at the time of delivery. If active herpes sores are present during labor, a cesarean section, C-section, may be recommended to avoid passing the virus to the baby. 2. Herpes and fertility treatments. Women undergoing fertility treatments such as in vitro fertilization, IVF, may wonder if their herpes diagnosis will impact their chances of success. Fortunately, herpes does not directly affect a woman's fertility or her ability to conceive. However, it is important for patients undergoing fertility treatments to communicate their herpes diagnosis to their healthcare team, as certain medications or treatments may need to be adjusted to manage the condition during the fertility process. Antiviral therapy may be recommended to ensure that any outbreaks are controlled during key stages of fertility treatment. Thank you for watching. Stay informed, stay healthy, and Hare Krishna. Don't forget to like, share, and subscribe for more informative content.